What if what your doctor was telling you was actually making your back pain worse? If you're suffering with chronic low back pain, you're not alone. It's been the #1 cause of disability for years. But why, I ask you? If there are so many well-meaning health professionals trying to solve the problem, why is the problem just getting worse? One of the biggest reasons may surprise you. The advice, the treatment, and the procedures that you're getting may actually be hurting you, not helping you. I'm not talking about mild backache. I'm talking about serious, debilitating, chronic low back pain that changes and alters your life. How frustrating is that to not only live with the pain and trying to do everything right, only to find out you've been given the wrong advice. In this video, I'm going to show you 10 common things your doctor or other health professional may be doing or telling you that may actually be making your back pain worse and keeping it from ever healing properly. Please stay with me till the end because number 10 is so common, yet so wrong. It's time to finally get you on the road to healing. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. So what is number 1 on the list of the 10 things that your doctor may be telling you that's actually getting your back pain worse? Number 1, they're putting you on painkillers. Now listen, I get it. The pain can get so bad that you need to break that pain cycle. But for those of you who are living on painkillers, anti-inflammatories, muscle relaxants for a prolonged period of time, you're not getting at the underlying cause. You say you know the risks. And with painkillers, Tylenol, acetaminophen is the #1 cause of acute liver failure. With anti-inflammatories, you have a 1 in 1,200 chance of dying if you've been on them for 2 months or longer. We all know what's happened with opioids. The problem is it's not just masking the pain. What no one's telling you, it's allowing the problem to get worse. All these conditions are actually progressing, and if you are continually masking the pain, you're actually allowing it to be worse, and you will be a lifetime candidate for staying on those drugs, which will never fix the problem. It will always come back. Number 2 on the list of 10 things your doctor may be telling you that's making your back pain worse, when they tell you back pain is self-limiting. So what does that mean? Well, self-limiting means if you do nothing, 2 weeks from now, your back pain should be gone. So what's the problem with that? The problem with that is back pain is the #1 cause of disability. The problem with that is it's billions of dollars. And the problem with that is that the other 20% are the cases that then become chronic because you've done nothing about them. Chronic cases make up 96% of the cost of back pain. And it's not just the cost. Even if you had self-limiting where the pain would go away, it doesn't make sense to see a professional who knows what they're doing, who can then speed up your recovery. And last but not least, why would you want that acute problem to turn into a chronic problem in the first place? And then finally, you're never treating the underlying cause of the problem. Getting that type of advice that it's self-limiting, and you'll read this in a number of the scientific journals, it's just bad clinical advice because we know what's going to happen. It's what I call the 7-Eleven syndrome. You're getting the exact same advice from your health professional that you would get from the guy standing behind the counter at 7-Eleven. Essentially, they're telling you to do nothing. That's exactly what the guy behind the 7-Eleven counter would tell you to do as well. Make sure that you take care of the underlying cause of the problem. Number 3 on the top 10 things that your doctor may be telling you that may actually be making your back pain worse is when it comes to x-rays. So number 1, yes, you should get an x-ray. I know there are some doctors who say, well, no, that those aren't necessary. This is common back pain. The problem is you're missing all of the underlying causes. If you're one of these people who thinks that you only take x-rays for a fracture or a tumor, boy, are you allowing your back to deteriorate. Number 2, in that same range of needing x-rays, is those x-rays need to be taken standing. So most, unfortunately, medical doctors, hospitals take those x-rays while you're lying down. You want to know what's happening to the spine while you're actually using it. So that's why you can have x-rays taken sometimes. Same thing applies to an MRI. And if you're lying down, then the spine's not really putting any pressure on the disc, so you don't even notice, or the x-ray doesn't pick up the problem in the first place. So ensure that you're taking standing x-rays if you truly want to know what's going on with that spine. Number 4 is you're waiting forever for that MRI. Understand MRIs, contrary to popular belief, are not the end-all be-all. Do they have pertinent information? Absolutely yes. But up here in Canada, we often wait 6 months for an MRI while we do nothing, which just allows the problem to progress. Or we think we're, because we're on painkillers, that we're keeping it at bay. No, again, we're allowing it to actually get worse. The second thing is MRIs are not the end-all be-all that you need. There's study after study after study where they've shown people on MRI with significant disc herniations who had no pain whatsoever. And there's study after study after study that has shown MRIs where people had no disc herniation who had significant pain. Do they serve a purpose? Yes. That purpose, though, is mostly for the surgeon to know where to go in if they're going to do surgery. And of course, that should always be a last resort. So I've actually trained with a doctor who's considered probably the preeminent doctor on spinal stenosis in the world. And he puts MRI at maybe number 8 on the list of things he needs to see. So again, don't wait for the 6 months. We have lots of patients who get under our care and we actually have them fixed before the MRI date ever comes up. Number 5 on the list of 10 things that your doctor may be telling you that may actually be hurting your back pain is just go strengthen your core. Now, understand where I'm coming from. I actually founded the rehabilitation program at the Ottawa Sports Science Center up here. I've seen everyone from world's fastest man, NFL, NHL, CFL players, gold medal sprinters, World Cup champion skiers. I'm a bigger fan of exercise than anyone, and yes, core does play a role, but not when you're just injured. If you have a disc herniation, if you have a tremendous amount of pressure on the nerve, that's not the time to go put more pressure on it. So you'll get a lot of people will be faulted or guilted when they're suffering from serious back pain, and their friends and family members will say, oh, gee, he's just lazy, she's just lazy, just go strengthen your core and everything will be fine. There's a time for that, not when you're acutely injured. You need to correct the problem first, and then down the road, we look at stabilizing and strengthening. Number 6, just go lose some weight. How many times have you heard that? And listen, again, if you are severely overweight, putting more pressure on a disc or on a nerve can in fact aggravate that. But think about this, that's not the sole problem. And so when you're told just to do that, you never address the actual underlying causes of the problem. So, and all that's happening is that you're actually made to be guilted or shamed, that you're overweight. The reason this becomes so important is, as I said, you never fix the underlying cause of the problem. But number 2, the best way to put this into perspective, skinny people get back pain as well. Number 7, you're told back pain is just natural with aging. That's not true. You know many people your exact age who have no back pain whatsoever, and you know people your exact age who have a lot more pain than you do. It's not age, it's what you do or what you don't do over that time. If you want to hear what I think cute little stories, society has 2 beliefs that they so strongly believe, but we ever bother to put them together, we realize they make no sense whatsoever. So the world believes that time's going to cure everything. And that's simply not true. The only place that's true is in a romance novel where time heals all wounds. All that time by itself does is it allows things to fester in there. And understand, I am a bigger believer that the body has this incredible ability to heal itself, but you need to do the right things over that time, because we also believe that we're all supposed to get worse as we get older. They can't both be true. If time cured everything, we would all get better as we get older. So never accept the idea of age as an excuse for why you have your back pain, and it becomes a self-fulfilling prophecy, because then you don't go out and do the things you need to do to correct the underlying cause and prevent it from ever happening in the first place. Number 8 on the top 10 list of things your doctor may be telling you that may actually be hurting your back pain, or certainly not helping you get any better, is taking an epidural or a cortisone shot. So again, I know that there are some patients who have taken that cortisone shot and they think it's God's gift and the pain goes away and so forth. Here's the issues. First of all, would you be surprised if I told you that epidurals have never been approved by the FDA? That's right. What you think is this common standard practice has never been approved for use in back pain. When it comes to cortisone, are they telling you that repeated cortisone shots are going to actually weaken the tissue? So again, you might get away with that one cortisone shot. In our experience, it's a flip of a coin. Some people will love them because it masks the pain, helps to clear the inflammation, but it's not getting to the underlying cause. The other half of our patients find that it really didn't help much at all, comes back quite quickly, and over time, you certainly don't want to be weakening the tissue. Number 9 on the list of things that your medical doctor or other health professional may be telling you that's actually hurting your back pain is if they are anti-chiropractic. Now, I know that sounds a little strange. How could you be anti an entire profession? Some people have had bad experiences with a chiropractor. Guess what? You've also had bad experiences with a physiotherapist or a medical doctor or a dentist or a mechanic. And then the problem is they think all chiropractors are like that. If you want proof of this, the absolute best athletes in the world all get regular chiropractic care because they understand they're actually restoring function. They're optimizing performance. To say that you tried chiropractic is like saying you went on a diet and you tried food. They understand there are multiple different approaches. There are multiple different styles of practice. If you've had one bad experience, please don't give up, because the only person that's hurting is yourself. And number 10, and please stick around for the bonus, number 10 is you're told to put heat on an acute injury. This happens all the time. I understand why it happens, but it's the absolute wrong thing to do in most cases. Think of what's happening. Anytime you're going to have an injury, people often ask, is it muscle, is it nerve, is it joint? It's always going to be all three of them, because that muscle is controlled by the nerve. That muscle actually puts tension on those joints. Those joints can then impinge those nerves. They're all connected, but with that, you're going to get inflammation. You do not heat up an inflammation. The reason people put heat on, or doctors tell them to put heat on, is they'll feel those tight muscles, but those muscles are reacting or protecting that area. You don't want to heat up something that's already inflamed. Those are the people who will soak in a hot bathtub late at night, and they actually feel nice in the bathtub. They wake up in the morning stiff as a board, and they don't understand why. And it's just you've just heated up the inflammation. And some medical doctors make that even worse, where they'll tell you to put heat, and they'll give you an anti-inflammatory at the same time. Why are they giving you contradictory advice? If they're giving you an anti-inflammatory, they know there's inflammation. Do not heat up the inflammation. You're far better with ice. 10 minutes on, 10 minutes off, 10 minutes on, 10 minutes off. When you're tired of doing that, put it on for another 10 minutes. Make sure it's cold enough that the body absorbs the cold. Make sure it's not so cold that you actually frostbite yourself, and yes, that does happen. And our bonus, because there are more than 10 things that you're being told, is they never talk about your mental health. We're not talking about the little backache. People who are living with serious, chronic, debilitating, life-altering pain, this changes their lives. It will affect mental issues, mental health issues. It will affect isolation. You'll have friends and family who think, hey, they've been to 10 different doctors and no one can find anything wrong, so it must all be in their head type of thing. Over time, that is going to take a toll on you. And then the answer to that is not for your medical doctor just to give you an antidepressant. The goal is to actually fix the underlying cause of the problem. You are not alone. These aren't people who are falling through the cracks. There are many, many, many people who suffer this way. We've had patients who are actually on the MAID up in Canada. That's the assisted suicide list with the government. This is how bad this pain can get. Please reach out and please fix the underlying cause of the problem in the first place. If you feel like there is no hope, that you've tried everything, please reach out to us. We deal with patients and issues like this all the time. It's not hopeless. Okay? Please reach out to us at excellenceinhealth.com or 613-688-1036. If you enjoy this video, or you found it a benefit, or there are others who could benefit from this advice, please like it, please share it with those who need it. Because again, there are so many people living with this type of pain who don't need to live with this. The next video you should watch is the one right here. Okay? Please go watch, please go learn from this, and again, take action.